Natural and home remedies for pervasive developmental disorder. Autism is a very complex neurodevelopmental disorder that normally presents itself from birth, which is why parents usually become aware of it within the first 2 years of life, as a child's personality begins to develop. Autism is most commonly identified by unusual social behavior, low interaction skills, communication difficulties, and compulsive or repetitive behavior, in some cases. Since the cause of autism has been such a widely and hotly debated topic for so many years, it can be difficult to suggest preventative therapies. However, autism is highly hereditary, although environmental factors have also been shown to have an impact on the likelihood of autism. There is no medicinal cure or formal treatment for autism, although there have been many breakthroughs with behavioral therapy to help autistic sufferers get past the sometimes crippling social impairment of the disorder. In the past, the label of autism was much narrower. It now falls under autism spectrum disorder, which also includes Asperger's syndrome, child disintegrative disorder, and pervasive developmental disorder. Although these conditions are similar, there are certain distinct differences and levels of severity. Fish oil, omega-3 fatty acids, along with some other types of fatty acids, are actually beneficial and essential for the body's normal, healthy development. Studies have shown that high levels of omega-3s can increase socialization in people suffering from autism and can also soothe hyperactive behaviors and disruptive behaviors. Fish oil is one of the most concentrated and easily accessible forms of omega-3s, and the supplements can be found almost anywhere. Melatonin, one of the most closely related conditions to autism, is poor sleep habits. The disruption in normal sleep cycles can cause irritability, lack of focus and concentration, social anxiety, and chronic stress. Melatonin, however, is a soothing, sedative substance that can ensure healthy, restful nights of sleep, thereby helping autistic children to maintain a more relaxed schedule. The related behaviors of poor sleep will diminish, enabling more effective practice of social and communication skills. Probiotics. Many researchers have argued that one of the most obvious causes of autism was dietary in nature. In other words, the health of the gut and the intake of nutrients were the two major culprits behind the severity, or even development, of autism. Intestinal permeability has been closely linked to autism, and probiotics are often the best remedy. Probiotics stimulate the growth and development of healthy, beneficial bacteria in the gut that helps us efficiently absorb nutrients and protect the gut from any infections. Probiotics can be found in ample supply in yogurt, and with a healthier gastrointestinal system, some of the symptoms of autism may diminish. Sugar-free and gluten-free. Although research is still ongoing on this particular treatment strategy, there are many who believe that by eliminate sugar, gluten, and other processed foods, the symptoms of autism can be reduced and behavior begins moving back towards normalcy. This is a very hot topic of debate at the minute, particularly with the increased attention being placed on gluten in recent years, and the rise of gluten-free diets, regardless of whether it is due to a food allergy or not. Antibacterial and antiparasitic. Other theories about autism from an environmental perspective argue that autism develops due to the child's gut being exposed to candida bacteria and other parasitic substances that leave toxic residues in the gut. This very dangerous bacterial exposure at a young age could explain many of the symptoms of autism. Therefore, protecting children from dangerous bacteria and parasites is essential to fully protect them from the possibility of developing the disorder. Vitamin D. This critical nutrient in our diet is often forgotten or overlooked in exchange for the more high-profile vitamins. However, vitamin D is crucial for both children and mothers. Low levels of vitamin D in pregnant women have been connected with higher levels of infant autism, while vitamin D deficiency is linked with leaky gut syndrome and other conditions that affect the gastrointestinal system, a critical aspect of autism development. As explained above. Finally, vitamin D affects the function of neurotransmitters, which are often negatively affected in autism sufferers. Vitamin C. Autism sufferers appear to have higher frequency rates of scurvy, as though their bodies do not process or intake it well enough, further supporting the validity of a diet-based strategy to reduce the symptoms. Keeping a high vitamin C intake in the body helps with the development of collagen, antioxidant activity, cognitive function, and cellular repair and health throughout the body, all of which could improve the symptoms and sensitivities of certain autistic individuals. Turmeric. As one of the most potent and versatile herbs in common use, turmeric offers antimicrobial, anti-inflammatory, and antioxidant effects to the body. This can significantly improve the health of the gut and ensure proper nutrient intake so that many of the symptoms of autism can be lessened or eliminated altogether. A final word of warning: it is important to remember that autism is a disorder, not a disease, and as such, there is still no formal cure, nor will there likely ever be. These are supplemental remedies, and should be combined with behavioral therapy as well. On their own, neither approach would be particularly effective. Always speak to a doctor if you suspect that your child suffers from autism, because the different types of disorders within autism spectrum disorder often utilize different treatment approaches. Probiotics and probiotics. Be mindful, not all probiotics are created equal. Probiotics are like antibiotics, one may not substitute for other. Also, most of the popular yogurts available in market, even when include live cultures, do not provide much probiotic benefit. Vitamin D supplementation. Evidence suggests that vitamin D strengthens barrier function and reduces the intestinal hyperpermeability or leaky gut. Vitamin D receptors are present in brain. In addition, vitamin D affect neurotransmitters. Low maternal vitamin D level is a risk factor for infantile autism. There is controversy over what the normal levels are. Many experts believe that the lower limit of normal is too low and may be missing out on people that may benefit from vitamin D supplementation. Turmeric, the all-round golden herb/spice, it has antimicrobial, anti-inflammatory and antioxidant properties, all of which have potential to impact dysbiosis and leaky gut. Dietary modifications including trial of elimination diet. In addition, eat your foods organic while avoiding processed food. Chew very well, or better still, eat shredded or finely cut salads. Cut your food in plate and not rely on chewing to accomplish that. Smaller pieces are easier to digest and undigested foods are easier to expel by gut's housekeeper function via migrating motor complexes. Avoid frequent snacking between meals in order to allow gut's fasting motility pattern to take care of cleansing, housekeeping function.